Okay, so let's go on to a different topic. There will be quite a bit of HIV in your pharmacology class. So there's going to be overlap there where you'll hear about HIV drugs and how they affect the division of the HIV virus and try to stop replication. Okay, so there's going to be overlap of this class and pharmacology. Okay, let's go on to some white blood cell disorders. Okay, so white blood cells are the infection-fighting cells of your body. And when we're talking about leukocyte disorders, let's talk about a condition called neutropenia. So neutropenia is when your neutrophils are too low, right? So they're typically too low because the patient is receiving chemotherapy for a particular cancer that's led to bone marrow suppression and neutropenia, okay? And neutrophils are heavily involved in fighting off bacterial infections as part of the innate immune system, okay? Now, there's also some medications you're going to hear about in pharmacology where a patient takes a certain medication and as an adverse effect, it leads to bone marrow suppression and neutropenia. That can definitely happen. But the most common way to get it is through receiving chemotherapy to try and treat a cancer. Okay. Now, when we say neutropenia, we're referring to a neutrophil count that's typically less than 1,500. Okay, but there's a spectrum there. As it drops from 1,500 to 1,000 to then 500, it's becoming more and more severe. So a neutrophil count of less than 500 really puts the patient at risk for getting a bacterial infection. Okay, so those patients would be counseled on reporting any signs of infection. If they have a fever, if they're developing a cough, if they have a sore throat, if they have anything that's an indication of infection, they need to report those immediately, okay? Because that's the main concern of getting an infection that can then overwhelm the body, okay? So monitoring of temperatures frequently with anyone who's neutropenic. The fevers need to be reported. Even low-grade fevers, so 38 degrees with a neutropenia is enough to come to the emergency room and report it, okay? So, and the other important counseling topic is protecting patients from infection. So advising them and not to go around areas with crowds, not to hang out in the mall, not to see anyone who has an illness or is potentially unwell, trying to avoid children that have colds, since children often seem to have colds, and avoiding eating raw food, so raw vegetables, undercooked meat, undercooked vegetables, that's important as well. Okay, so let's talk about leukemia. But just before getting to that, I just want to mention something on the above slide about neutropenia, just maybe to clarify it a bit more. So if someone's receiving chemotherapy drugs to fight a cancer, it suppresses the bone marrow, and it'll suppress all of the cell lines of the bone marrow, the red blood cells, the platelets, and the white blood cells. So when we get a blood test, we can see all those values on the blood test, right? Your white blood cell count should be between 5 and 10,000. Your hemoglobin, depending on whether you're male or female, should be typically above 12. and your platelets should be between 150,000 and 400,000. When we look at a blood test, so a CBC, and we see that someone is leukopenic while they're receiving chemotherapy drugs. So leukopenia just means low white blood cell. Okay, well, that's concerning because they're at more risk of infection. But what's even more concerning is if they have neutropenia. And because we get a CBC with a differential, the differential is the 5 different types of white blood cells that make up the total white blood cell count. So if you have a white blood cell count of 3,000, well, we get a differential, and it tells us exactly how many are platelets. How many are neutrophils, how many are lymphocytes. And what we really want to see is that neutrophil count is above around 1,500. And the lower the neutrophil count is, in terms of being neutropenic, the more concerning the risk of infection will be. Okay? All right, so let's move on to leukemia. So leukemia is a cancer that affects the white blood cells, right? So overproduction of abnormal and immature white blood cells. And this is a problem because that's occurring in the bone marrow. And the bone marrow gets packed and congested with very abnormal and really non-functioning white blood cells. So it stops the normal production of the other cell lines. So what can happen? Well, you're going to develop anemia. So your red blood cells aren't going to be produced because all of these cancerous white blood cells are just packing the bone marrow. You're not going to produce your platelets, so you will develop thrombocytopenia. Okay, so not only will the white blood cells be super elevated in the bloodstream, you'll be anemic and you'll be thrombocytopenic. Okay, so remember your values. Typically your white blood cell count is between 5,000 and 10,000. Your typical hemoglobin is around 12 or greater. Your platelets are usually between 150,000 to 400,000. Okay. Now, leukemia can be caused by an assortment of genetic conditions and environmental causes, and we'll go into this more in another module. Okay, so what's anemia? Well, anemia is reduced circulating hemoglobin in your red blood cells, or we can define it as a reduced hematocrit. Your hematocrit is what percentage of your blood is made up of red blood cells. So usually that's around 40 to 45% of your entire blood volume is red blood cells. Okay, so we can define anemia in many different ways. Basically, it just means reduced red blood cells and reduced hemoglobin. And that leads to fatigue, weakness, shortness of breath, dizzy. Why are you dizzy? Because the blood is not delivering as much oxygen and nutrients to the brain. So your brain's going to respond with symptoms such as dizziness. Okay. You have ineffective white blood cells. These cancerous white blood cells are ineffective. So you're at risk for all kinds of infections, mouth sores, definitely fevers, infections anywhere in the body, and then finally sepsis, which is a overwhelming bacterial infection in the bloodstream, leading to abnormal vital signs and organ failure. Thrombocytopenia, that's where you start to get your platelets dropping below 150,000. That's going to cause petechiae on your skin, those little tiny pin dot red markings on your skin are little tiny hemorrhages from your capillaries. Purpura are the bigger bruises on your skin, on your face, on your arms, on your legs. Bleeding gums can be a sign of thrombocytopenia, or bleeding within the gastrointestinal tract, which could lead to vomiting of blood, called hematemesis, or rectal bleeding, which, if it's coming from your stomach, we call melena. Okay, so let's look at this slide on symptoms of leukemia. Okay, and remember, it's a cancer, right? So it's a cancer of the white blood cells that results in reduced production of basically all the cell lines in the bone marrow. So your red blood cells, your platelets, and even your normal white blood cells are deficient. And you have huge numbers of very abnormal, ineffective white blood cells in the bloodstream. So if we look at some of these symptoms, fever and frequent infections for sure, because the white blood cells are really ineffective. Even though you have tens of thousands of them as a white blood cell count, they're not really infection fighting white blood cells because they're cancerous. Shortness of breath. Well, that's going to occur because you're anemic. Okay, and when you're anemic, you just can't carry enough oxygen on in your red blood cells on the hemoglobin. Muscular weakness, definitely because the muscles aren't getting enough oxygen from the red blood cells. Okay, so you'll just have overall fatigue and weakness. We'll skip over the bone and joints. That's not really a terribly common one. Let's go to psychological. So fatigue, again, that's going to be caused by anemia, loss of appetite because of the cancer, right? It's still leukemia is a cancer, so it releases a lot of factors in the bloodstream that cause you to lose your appetite. Lymph node swelling. Well, the lymph nodes are part of the immune system, and they're going to become filled with all these cancerous white blood cells. So lymphadenopathy or lymph node swelling. Your spleen and your liver, well, they have a lot of circulating blood through them, and the spleen is part of the immune system that stores white blood cells. So you can have a huge spleen, okay? And that can be an indication of leukemia. Night sweats are common in certain cancers because there's so much inflammation going on. The easy bruising is due to the thrombocytopenia. The purplish patches, which really they're just referring to the purpura, which are larger patches of bruising, again, are from thrombocytopenia. So this next slide is just showing you what's happening in the bloodstream. So normal blood is typically very populated with red blood cells, right? So remember, 40 to 45% of your circulating blood volume is red blood cells to carry that oxygen all over your body to different organs. There's only 1% that's typically taken up by white blood cells. And platelets, a really, really tiny percentage of your blood volume would be platelets because they're so tiny, right? So there's a normal appearing blood. Mostly red blood cells, some white blood cells circulating, and of course some platelets. Let's look at the slide with leukemia. So the red blood cells are very deficient because they're not being produced in the bone marrow. The platelets will be low in numbers, again because of lack of production. And these very abnormal white blood cells that are circulating in the bloodstream, but really they're not infection fighting white blood cells. They're really abnormal cancerous cells. Okay, so think of all the symptoms that you can get when your 3 cell lines are impacted. So your white blood cells aren't working well, you're going to get infections. Your red blood cells are deficient, you're going to get weak and dizzy and shortness of breath and chest pain and fatigue. You're going to look pale. Your platelets are low, you're going to get bleeding in your gums, bruising of your skin, petechiae of your skin, gastrointestinal bleeding. So think of all of those potential symptoms and signs, because all the 3 cell lines are being affected. Okay? And that goes for any disease or condition that causes bone marrow suppression. All 3 cell lines get impacted, and then you get signs and symptoms based on the lack of the 3 cell lines. Okay, I'm not going to spend too much time on this slide. This is just to let you know that there's acute types of leukemia, which can be very aggressive. Luckily, the first one, ALL, which occurs in children, is now very treatable with a fantastically high cure rate. So in the 1950s, the cure rate was next to nothing for this particular cancer. There would be large wards, children wards, filled with children that had ALL, acute lymphoblastic leukemia. Now it's a highly curable disease. Okay, the chronic leukemias, chronic lymphoblastic or chronic myelogenous, sorry, I was going to say myeloblastic leukemia. People can live with for years with these, right? So they're chronic, slow-growing leukemias. The very aggressive one is the second to the left, AML, acute myelogenous leukemia. Okay, that can be in early adulthood to mid-adulthood. That one's more aggressive. But this is really just for your information to see that there's more than one type of leukemia, because there's more than one type of white blood cell. Okay, so we just spoke about this on the previous slide. ALL, most common in children, still a rare cancer, but fortunately very curable. CLL, so the lymphocytes, chronic lymphocytic leukemia, common in older patients, and as I mentioned, they can live for years with this cancer. And do they have an elevated white blood cell count in their bloodstream? Absolutely, it's a cancer, right? Does it progress to enlarged lymph nodes, fevers, night sweats, weight loss, and enlarged spleen? Definitely, but it just happens over years, okay? When we go to the myelocytic type of white blood cell, we have AML, very aggressive tumor that I mentioned in kind of mid-adulthood, sometimes in your 30s, 40s, or 50s, and CML, which is it's less common, but again, it's a leukemia of older patients, and often a chronic leukemia over years just mutates and becomes an acute leukemia, which is typically very resistant to any treatment. Okay. Okay, so when we're talking about cancers of the lymphatic system or lymph nodes, they're called lymphomas, right? And these cancer cells can develop in the lymph nodes themselves, in the thymus gland, the bone marrow, or the spleen. Okay, and they're typically made up of T cells or B cells. Okay, and they lead to night sweats, fevers, weight loss, very enlarged lymph nodes, sometimes in the neck, under your arm. You can have enlarged spleen. So when you see the term lymphoma, it's a cancer of the lymphatic system. Okay, so lymphomas are typically broken up into two groups: Hodgkin's lymphoma and non-Hodgkin's lymphoma. So let's just look at the difference a bit. So as I mentioned, in general, lymphomas are cancers of the lymphatic system and the lymph nodes. And there's definite links to genetics. So some of them can run in families. Some of them are linked to toxins. And some of them are even linked to infectious agents. So, for example, there's a virus called Epstein-Barr virus that's linked to developing a lymphoma later in life. Okay, so if you're on long-term immunosuppression for, say, an organ transplant or for an autoimmune disease that you have, you're at risk for developing lymphomas later in life because the immune system is being chronically suppressed. Okay, and as I mentioned, there's Hodgkin's and there's non-Hodgkin's type lymphomas. Okay, so Hodgkin's lymphoma. So this is typically a younger person, and it's often non-painful in large lymph nodes of the neck, under the armpits, and in the groin. And often patients will come in with these swollen lymph nodes in these areas and have fever, night sweats, weight loss. And when we check them, they'll often have an enlarged spleen or enlarged liver because the cancerous cells are also involving the liver and the spleen. Okay, so this accounts for only about 1/10 of lymphomas. Most of them are non-Hodgkin's lymphoma. Okay, so as I mentioned, this is typically in younger adults, in adolescents. How can we tell it's Hodgkin's lymphoma? Well, there's a certain cell when we take a biopsy of the lymph node called the Reed-Sternberg cell, and that's diagnostic for Hodgkin's lymphoma. And luckily, Hodgkin's lymphoma is very treatable with cure rates of about 90%. So long-term cure rates of 90%, which is fantastic. Okay, so let's look at some warning signs or symptoms of lymphoma. Many of these symptoms are going to be common in any type of cancer. So let's start at the left. So fevers, they can occur in any kind of cancer. And night sweats. So why do you get fevers and night sweats? Because there's a lot of inflammation occurring within the body. Since your immune system is trying to fight the cancer. In lymphomas, you often have swelling of the lymph nodes. So in particular, in your neck, where you have a lot of lymph nodes, in your axilla, which is your armpits, and your groin as well, are common places to have enlarged lymph nodes, especially with Hodgkin's lymphoma. Non-Hodgkin's lymphoma often involves the lymph nodes that are within your chest and within your abdomen. Okay. Unexpected weight loss is common to many cancers, and it's aggravated by the fact that patients have lost their appetite. So cancers release a lot of mediators into the bloodstream and cause loss of appetite, which is then followed by weight loss. The feeling of weakness, well, that's going to be related to anemia. Lymphomas can spread to the bone marrow, just like any other cancer, and it can cause anemia, thrombocytopenia, and also a reduced white blood cell count. Breathlessness, again, another potential symptom of anemia, But also some lymphomas cause really enlarged lymph nodes within the chest. Okay. The itchiness that's mentioned here is when a lymphoma spreads to your liver. And this is not an important symptom really, because so many things cause itchiness. But whenever you get a liver disease or a cancer that's spread to the liver, you get a lot of waste that's not processed by the liver, and some of that waste can end up in your skin and will lead to itching. So itching is a common symptom of liver disease or liver failure. Okay, just to spend a bit of time on non-Hodgkin's lymphoma. Again, another cancer of the lymphatic system, right? So we spoke a bit about Hodgkin's lymphoma. Non-Hodgkin's lymphoma, you still have enlarged lymph nodes, often in the chest and in the abdomen. But like Hodgkin's lymphoma, you'll get weight loss, you can have fevers and chills, fatigue, night sweats. So similar symptoms to Hodgkin's lymphoma. And these account for about 90% of lymphomas in patients. And when the lymph node is biopsied and looked at under the microscope, they don't have any of those Reed-Sternberg cells present. Okay? Non-Hodgkin's lymphoma is much more commonly developed or acquired in middle age to older age, compared to Hodgkin's, which is in younger people. And as I mentioned, multiple sites of lymph node involvement within the chest cavity, the abdominal cavity. You can get it in your neck. So really enlarged lymph nodes all over. And this particular type of lymphoma is much more difficult to treat than Hodgkin's lymphoma. It doesn't have as a high of a cure rate as Hodgkin's lymphoma does to chemotherapy and radiation. Okay, so let's look at this question about a CBC and differential, a blood test that we took off a patient that is neutropenic. What's the most common cause of neutropenia? Usually chemotherapy drugs. Okay. So with a CBC and diff, what are the results we usually look at? So we look at white blood cell count, we look at hemoglobin, and we also get a hematocrit. And there's a bit of a difference between them, but not much, and we'll get into that when we do hematology. And of course, the platelet count. Okay, so a CBC and diff, the differential is the separation of the different white blood cell types. So as an example, let's use a CBC and diff. The hemoglobin is 12, which is fine. The platelets are 170,000, which is fine. And the white blood cell count happens to be 2, and the neutrophil count is 2,000, and the neutrophil count is 750. So they're neutropenic. What are they most at risk for? What do they need monitoring for? Their temperature, right? We need to monitor their temperature to make sure they're not getting febrile. Because often a patient who's neutropenic and febrile is harboring an infection. And we call them febrile neutropenics, right? So patients come to the hospital and they get admitted with a diagnosis of febrile neutropenia, meaning they've come in with fever, and when we check their CBC and diff, they're neutropenic. They typically get admitted into hospital for IV antibiotics. Okay, so always think of the potential for infection when you're immunosuppressed, and you're definitely immunosuppressed if you're neutropenic. Okay, so that's the end of this module. It's around 3.5 hours. There's a lot of information in it. I hope it makes sense to all of you. If there's parts that aren't clear, please bring them to tutorials so they can be clarified for you. Okay, so really your aim in pharmacology, in pathophysiology, is to get a well-rounded understanding of disease processes and, in pharmacology, how we treat them. And that will stay with you much longer, and it will serve you better when you're trying to answer questions. Okay, so the less memory, the better. Next week, we're going to move on to genetics and a whole new subject. Okay, bye-bye.